Hello, my name is Julianne Middle, and this is my physical exam video for Vet 221. Here I am doing a physical exam on Lucy, our 7-year-old goldendoodle spayed female. She is 55 pounds, and with me I have Dr. Boyd, my mentor. So Lucy's not due for any vaccines right now. We actually just updated those on August 30th, so we're just going to do her physical exam. We already updated her fecal, her heartworm test, blood work for the year, and also her annual vaccines along with her rabies, which we do every 3 years. So moving along here, I already checked her capillary refill time and just checking her teeth. She does have some moderate tartar on her teeth, and Dr. Boyd and I have made a plan to do a dental in the future for her. But right now I'm just checking her pupillary light reflex with the ophthalmoscope. Everything looks normal. Now attaching the otoscope and looking inside her ears, and I did not find any debris. Everything looks normal and clean. So right now I'm taking a feel of her lymph nodes, starting with her submandibular, her prescapular, and axillary lymph nodes. Everything felt fine and normal, no enlargement. Doing a rotation, and I'm going to do a heart auscultation, starting with her left side, where I'll listen for the aortic, mitral, and pulmonic valves. Taking her heart rate, and then I'll listen to the other side, outer tricuspid valve. Now listening for her lungs, no signs of crackles. Everything sounded clear. Doing a musculoskeletal exam on her front limbs, just being very stiff. Just very good girl. Doing an abdominal exam, feeling her bladder as well. Didn't feel any abnormalities. Checking her back legs as well. No signs of resistance or anything. Feeling her inguinal lymph nodes, her popliteal. Also just feeling her pulse while I was back there as well. I should feel her pulse while I'm also listening to the heart to make sure her pulses are strong and synchronous. I don't think I did that, but usually that's what I would do. And her integumentary system, just making sure there's no dander, her skin's nice, clean, and clear. Just very good. Alright, starting with her ocular tonometry test, I am using a Tonovet tonometer. It is handheld. It's very easy to use. And you want an ocular pressure from both of her eyes. So right now I'm getting that set up. It comes with a little pin that you place inside the hole of the probe, or the probe hole. And it's single use only. It is sterile. It comes in a little plastic seal, and you just drop that into the hole, and you press that gray button, make sure it's calibrated. Alright. And I want to get as close as possible to her cornea, but not too close. Make sure I'm parallel with the floor. Get at least a few good readings, and so it averages out your reading and gives you your total in millimeters of mercury. think it came out to 11 millimeters of mercury for that one. Alright, and that one's like, I think 11 as well, in her left eye. Okay. So now I'm setting up for a Schirmer tear test. I'll have both my strips in the plastic sterile seal. Setting up my thermoscope. That packet didn't have any. Had to open up a whole new box. Somebody threw in old ones in there. Alright, we have a winner. So pull that out. Open that up. Okay, so for this strip, I noticed I did this incorrectly. Usually you should pre-bend the tip while it's still in the package so you don't get your dirty fingers on there, but I did that wrong, so I'll admit that. So I'm starting with her right eye. I'm going to count for 60 seconds. Normal tear production for a dog is about 15 to 25, and it'll show up millimeters on the strip. I did give her trazodone before she came in. This is my dog, by the way. And she got 100 milligrams, 2 tablets before she came in. So actually, with trazodone on board, it lowers their tear production, so it may be a little bit lower than what a normal dog tear production is. Alright, now that we waited 60 seconds, her tear production was 5 millimeters, which again is not a lot, but yeah, she has trazodone on board, so her tear production is not going to be normal. I think it's actually going to be the same on her left eye. So I'll place that in there, and each strip has an indication whether it goes in the left or the right eye as well. Right, and that one also came out to around 5 millimeters as well on that strip. So now I have my fluorescein eye stain. I I have it set up already in a syringe. We have the strips, like a fluorescein dye on the strip, and I just dip it in a syringe with saline, and suck that up and just use that as kind of like a pipette to drip in her eye. It's less messy to me, and it's just what I would prefer. I also have some gauze in hand to collect the stain that falls from her eye. Getting my ophthalmoscope set up. Starting with her left eye, do a few drips in there. Get past her fluff. Just being a very good girl. Okay. And I just flush it with a little bit of saline, and I have my gauze. Just using light pressure to wipe away. So now I want to keep her eye open. Right, so then I have my videographer dim the lights for us. I'm using my cobalt blue light to see if I can see any stain pickup on her cornea, any signs of possible ulcers. Nothing was found, so her eyes were very clear. She did great. And I also just wanted to get her ear temp. It's a little late for that, but better late than never. There we go, and her temp was 99.1. So right now I'm grabbing all the supplies for a jugular venipuncture. I have a lavender top and a tiger top, my alcohol, a 3cc syringe, and a 22 gauge needle. I have Dr. Boyd restraining her properly by sitting behind her so she doesn't scoot back, and also lifting up her collar and her neck a little bit, not too much straining on her neck. Applying alcohol to the venipuncture site where her jugular vein is. I'm occluding that vein with my left hand, my thumb, feeling the jugular vein. Perfect, and so I will fill up that syringe fully with 3 cc's of her blood. Have Dr. Boyd occlude that area or apply firm pressure for 30 seconds. And so I'll fill both of those tubes with that sample. In this video, I don't have me packaging up this blood because we just did blood work on her earlier this week, but we usually send our blood out to Antec with a tiger top. I let it sit for 10 minutes before spinning it down in a centrifuge, and when it's spinning, I let that go for 10 minutes as well. Once the serum is separated, and we package that all together and send it all out to Antec. Alright, so that is it. Thank you very much for watching.